Magic Mushrooms by Julie Kinhart, Nursing 673, Herzing University, Dr. Keith Jenkins.
Psilocybin mushrooms are known as magic mushrooms or shrooms. These mushrooms contain psilocybin, which causes psychedelic effects, often resulting in mind-altering experiences. Psilocybin has been shown to reduce the amygdala's response to negative affective stimuli. These mushrooms are naturally occurring within nature. They are also known as mushy, blue meanies, golden tops, and liberty caps. The effects of magic mushrooms usually appear within 20 to 90 minutes of ingestion. Magic mushrooms have been around for thousands of years and have been used by indigenous peoples worldwide for medicinal and ceremonial purposes to connect to the spirit world. In 1957, American banker R. Gordon Watson brought magic mushrooms to the attention of America. This was through a photo essay published in Life magazine that featured the magic mushrooms. In 1953, Watson had discovered the magic mushrooms from an indigenous tribe in Mexico while vacationing. He brought a sample to Albert Hofmann, a Swiss chemist who had also discovered LSD. Hofmann isolated the psilocybin within the magic mushrooms and began distributing 2 milligram pills for research. In the 1960s, magic mushrooms gained popularity at music festivals, and particularly during the hippie movement. Magic mushrooms were made illegal in 1970 and placed on the Schedule I of the Controlled Substances Act. They were listed as having high potential for abuse and have been heavily criminalized. It's estimated that 17.9 million Americans use magic mushrooms each year. In a recent study of 7,139 participants, 7.4% of the participants had used psilocybin mushrooms within the past year. It was determined that within the studies, the user of magic mushrooms were primarily male with a median age of 38.1 years old. They were Hispanic, Latino, Spanish descent, and were the residents of the Western region within the United States. Magic mushrooms users are more likely to suffer from depression, anxiety, migraines, and insomnia. Users of magic mushrooms also reported a lower overall quality of life with higher scores on the GAD-7. The average score was 9.6 versus a non-user of 5.9. And the PHQ-9, the average score was 11.2 versus a non-user of 6.8. Magic mushroom users are more likely to suffer from depression, anxiety, migraines, and insomnia. Users of magic mushrooms also reported a overall lower quality of life and higher scores on the GAD-7 and PHQ-9. Users are less likely to be overweight than non-users. COVID-19 politics and election politics did not affect the demographic of users. After uses of magic mushrooms, 7.9% of users required medical treatment. Magic mushroom users are more likely to suffer from depression, anxiety, migraines, and insomnia. Users of magic mushrooms also reported a overall lower quality of life and higher scores on the GAD-7 and PHQ-9. Users are less likely to be overweight than non-users. COVID-19 politics and election politics did not affect the demographic of users. After uses of magic mushrooms, 7.9% of users required medical treatment. Shrooms can cause long and short-term effects. Some short-term effects include nausea, dry mouth, psychosis, synesthesia, altered perception, tachycardia, hallucinations, both visual and auditory, paranoia, chills, numbness, muscle spasms, inattention, feelings of floating, euphoria, anxiety, hypertension, lowered inhibitions, insomnia, excessive sweating, and dilated pupils. Long-term effects of shrooms include a negative shift in a person's affect. These people are also at an increased risk for both mood and substance disorders. There's also a risk of hallucinogen persisting perception disorder called HPPD. This occurs within 4.2% of people using hallucinogens and causes them to have flashbacks from the magic mushroom uses despite abstaining from these magic mushrooms. If the individual ingests the wrong kind of mushrooms, he or she runs the risk of ingesting a poisonous mushroom and thus dying. Shrooms can cause long and Some signs and symptoms of mushroom abuse include when the individual has to use more magic mushrooms than originally needed to have the same effects. This person spends much of their time procuring, using, and recovering from the ingestion of these magic mushrooms. Individuals also use magic mushrooms during activities that they could endanger others, such as driving or operating heavy machinery. These individuals need large amounts of shrooms to have the desired effect, and they use magic mushrooms to cope with difficult situations, mental health concerns, social events, etc. Lethal doses of psilocybin is rare. Users need to be sure of what mushrooms they are actually ingesting to ensure that they are not using a poisonous mushroom. Plan of care for a patient with a shroom addiction. Currently, there are no medications that are used to exclusively treat magic mushroom abuse. Individuals suffering from abuse of shrooms should be treated with CBT. CBT will help treat the patterns and behaviors that lead patients to use magic mushrooms. It will also teach them coping skills to use instead of using shrooms. Patients need to be educated on the effects, both long-term and short-term, of mushroom usage, including HPPD. Many patients who use shrooms have underlying mental health disorders that will need to be addressed by a mental health provider and medicated as needed. Patients should be referred to a psychotherapist and possible drug rehab center for further care. Patients should continue care under the psychiatric mental health nurse practitioner for psychiatric care. Patients will need to follow up frequently with their psychiatric mental health nurse practitioner to ensure the medications are producing desired results. While many believe magic mushrooms to be a harmless psychedelic drug, it has documented short and long-term physical and mental effects. Patients suffering from magic mushroom abuse should be treated with respect and receive treatment to help them with their addiction. With the proper care team, patients can overcome their addiction and live a sober life. Well,